Sepsis is a serious medical condition. It occurs when the body's response to infection goes into overdrive. Imagine your immune system, usually a protector, turning against you. This overreaction can damage organs and even lead to death. Sepsis is a silent threat, often striking quickly and without warning. It can affect anyone regardless of age or overall health. Understanding sepsis is crucial, as early recognition and treatment are vital for survival.
Our bodies have a natural defense system against infection. This system, known as the immune system, is designed to protect us from harmful invaders like bacteria, viruses, and other pathogens. It works tirelessly to keep us healthy and safe. When this system detects an invader, like bacteria, it triggers an inflammatory response. This is a crucial part of our body's defense mechanism. The inflammation helps to isolate the infection and prevent it from spreading to other parts of the body. This response is usually localized, targeting the infection site. For example, if you get a cut on your finger, the area around the cut may become red, swollen, and warm. This is your immune system at work, fighting off any potential infection. However, in sepsis, this response becomes widespread. Instead of being confined to one area, the inflammation spreads throughout the body. This can happen when the infection enters the bloodstream and triggers a systemic response. The immune system releases chemicals into the bloodstream. These chemicals are meant to fight off the infection, but in the case of sepsis, they can cause more harm than good. The widespread release of these chemicals leads to a cascade of events that can be very dangerous. This widespread inflammation can damage multiple organ systems simultaneously. Organs like the kidneys, liver, lungs, and heart can be affected. The damage can be severe and may lead to organ failure if not treated promptly. This chain reaction can lead to a dangerous drop in blood pressure, known as septic shock. When blood pressure drops too low, it can prevent vital organs from getting the oxygen and nutrients they need to function properly. Septic shock is a life-threatening condition that requires immediate medical attention. Early recognition and treatment are crucial for improving the chances of survival. Medical professionals may use a combination of antibiotics, fluids, and other medications to stabilize the patient and treat the underlying infection.
Preventing sepsis starts with understanding its triggers. Most cases arise from common infections like pneumonia, urinary tract infections, and skin infections. Timely and appropriate treatment of these infections is crucial in preventing sepsis. This includes taking antibiotics as prescribed and seeking medical attention for persistent or worsening symptoms. Good hygiene practices play a vital role in preventing infections in the first place. This includes regular hand washing, covering coughs and sneezes, and keeping wounds clean and covered.
Sepsis can be difficult to diagnose as its early symptoms often mimic other conditions. However, being aware of the warning signs and seeking immediate medical attention is crucial. Common symptoms include fever, chills, rapid heart rate, and rapid breathing. Other signs include confusion, disorientation, and skin discoloration. If you or someone you know experiences these symptoms, especially following an infection, seek immediate medical attention.
Children, especially infants and young children, are particularly vulnerable to sepsis. Their immune systems are still developing, making them more susceptible to infections. Parents and caregivers should be extra vigilant in monitoring children for signs of illness. Early recognition and treatment of infections in children are paramount in preventing sepsis. It's essential to communicate any concerns about a child's health to a healthcare professional promptly.
Early detection is key in treating sepsis effectively. The sooner treatment begins, the better the chances of survival and recovery. If you suspect sepsis, don't hesitate to seek medical attention immediately. Time is of the essence in managing this life-threatening condition. Healthcare providers use a variety of tests to diagnose sepsis, including blood tests, urine tests, and imaging scans.
Section 7. Sepsis treatment. A race against time. Sepsis treatment typically involves a multi-pronged approach. Antibiotics are administered to fight the underlying infection, often intravenously. Intravenous fluids are also given to maintain blood pressure and organ function. In severe cases, patients may require breathing support or other organ support therapies. The goal of sepsis treatment is to stabilize the patient's condition, control the infection, and prevent further organ damage.
Section 8. Long-term effects of sepsis. Even with prompt and appropriate treatment, sepsis can have long-term consequences for survivors. Some individuals experience fatigue, muscle weakness, and difficulty concentrating. Others may develop post-sepsis syndrome, a condition characterized by physical and emotional challenges. These challenges can persist for months or even years after the initial infection. Support groups and rehabilitation programs can be beneficial for sepsis survivors navigating the long-term effects of this serious condition.
Section 9. Raising awareness, saving lives. In this chapter, we delve into the critical importance of spreading awareness about sepsis, a condition that claims countless lives each year. Raising awareness about sepsis is crucial in improving early recognition and treatment. Early recognition can significantly increase the chances of survival and reduce the long-term impact on patients. Public education campaigns can help people understand the signs and symptoms, as well as the importance of seeking prompt medical attention. These campaigns can be conducted through various media, including social media, television, and community workshops, ensuring the message reaches a broad audience. Healthcare professionals also play a vital role in educating patients about sepsis prevention and early detection. They can provide valuable information during routine checkups, hospital visits, and through informational brochures. By equipping patients with knowledge, healthcare providers empower them to take proactive steps in recognizing and responding to sepsis. By working together, we can reduce the burden of this life-threatening condition. Collaboration between healthcare providers, public health organizations, and the community is essential. Joint efforts can lead to the development of better diagnostic tools, treatment protocols, and preventive measures. Every effort to raise awareness has the potential to save lives. Whether it's through educational programs, community outreach, or policy advocacy, each initiative contributes to a greater understanding of sepsis. By fostering a well-informed public and a responsive healthcare system, we can make significant strides in combating this deadly condition. Together, we can create a future where sepsis is recognized early, treated promptly, and ultimately, where more lives are saved.
Section 10. A call to action. Join the fight against sepsis. Sepsis is a life-threatening condition that arises when the body's response to infection causes injury to its own tissues and organs. It can lead to shock, multiple organ failure, and death, especially if not recognized early and treated promptly. Sepsis is a global health crisis that requires a collective effort to combat. Every year, millions of people around the world are affected by sepsis, and it remains one of the leading causes of death and disability. The impact of sepsis is felt not only by the patients, but also by their families, communities, and healthcare systems. By understanding the risks, recognizing the signs, and seeking prompt medical attention, we can all play a role in preventing and treating this serious condition. Early symptoms of sepsis can include fever, increased heart rate, increased breathing rate, and confusion. As the condition progresses, symptoms can worsen rapidly, making early detection and treatment crucial. Let's work together to raise awareness, promote prevention, and improve outcomes for those affected by sepsis. Education and awareness are key components in the fight against sepsis. By educating healthcare professionals, patients, and the general public about the signs and symptoms of sepsis, we can improve early detection and treatment. Together, we can make a difference. Healthcare professionals play a critical role in the early identification and management of sepsis. By implementing best practices and guidelines, they can help reduce the incidence and severity of sepsis. Sepsis is a fight we can win, but it requires our collective action and commitment. By working together, sharing knowledge, and supporting each other, we can make significant strides in reducing the impact of sepsis on individuals and communities worldwide. Join us in this vital mission to save lives and improve health outcomes.